Good afternoon. I'm Jonathan Lynch with CDC's Environmental Health Nexus. Thank you for joining us for today's webinar about protecting yourself from mold. Next slide, please. Today's webinar is being recorded. If you do not wish for your participation to be recorded, please exit at this time. The recording will be available a few days after the webinar. It will be available at the Nexus webpage. That's cdc.gov/nceh/ehsp/ehnexus. Next slide, please. A few points about webinar logistics. All attendees are muted. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. You can also submit questions to the presenters in the Q&A window. If we don't address your questions during the webinar, you can send them to ehnexus@cdc.gov for follow-up. Closed captions are available for this webinar. Just click the closed captions button on your screen. Today, we're going to hear from Ginger Chew, Scott Damon, and Amel Omari. Ginger Chew is the senior scientific advisor for CDC's Division of Environmental Health Science and Practice at the National Center for Environmental Health. Dr. Chew's research focuses on exposure assessment of aeroallergens and fungi in the indoor environment. Dr. Chew has led mold assessment investigations after Hurricane Katrina and given technical assistance in the aftermath of Hurricane Sandy and Hurricane Harvey. Scott Damon has been the health communication lead for CDC's Asthma and Community Health Branch, the unit that addresses mold and indoor air quality, since 2002. Amel Omari is an Epidemic Intelligence Service Fellow at the National Institute for Occupational Safety and Health in the Division of Field Studies and Engineering. Her background has focused on health behavior, racial and ethnic health disparities, and health equity. Ginger, please begin.
All right, thank you very much for that introduction. I appreciate it. Molds are types of fungi. They are related to, but different from mushrooms and yeast. Mold is a general term for types of fungi that are velvety, fluffy, or cotton-like, unlike yeasts, which are slimy or wax-like. Mold can grow on organic surfaces such as wood, fabric, or paper if they are damp. Outdoors, mold plays an important role in nature by breaking down organic matter, such as dead trees and leaves. Indoors, however, mold and yeast growth, all types, regardless of color, should be avoided. Next slide. Here are some examples of things that are not mold. Rust can result from water damage, but it is not mold. Nonetheless, it could be a marker for where mold might grow. Likewise, water-damaged ceiling tile is not mold, but it could be a marker for potential mold growth on the other side of the tile. Like mold, you can find algae where there is a lot of water. However, it is different from mold. Next slide. Mold is found in virtually every environment. It can be detected indoors and outdoors, year-round. Mold growth is encouraged by warm and humid conditions. Outdoors, mold can be found in damp areas or places where leaves or other vegetation are decomposing. Indoors, mold can be found where humidity levels are high, such as showers. It is impossible to eliminate all mold and mold spores in the indoor environment. However, mold growth can be restricted by controlling moisture indoors. Common sources or causes of water or moisture problems include roof leaks, leaks from plumbing, window air conditioners, and other appliances, condensation associated with high humidity or cold spots in the building, and localized flooding. Next slide. Common sites for indoor mold growth include bathroom tiles, basement walls, areas under windows where moisture condenses, under leaky sinks. Possible locations of hidden mold can include leaking or condensing pipes, walls behind furniture where condensation forms. This can occur especially if furniture is pushed against cold exterior walls of the home. Drain pans inside air handling units. Ductwork. For more information, you should check out EPA's Should You Have Your Ducts Clean? It's a publication that we can provide later. And then finally, roof materials above ceiling tiles. If the roof leaks or if it's poorly insulated, this can occur. Next slide. This is a photo of mold growing on a ceiling tile. Next slide. This mold growth occurred after a plumbing leak. Next slide. This slide shows an infrared photo of the temperatures of different surfaces in the home. The box shows temperature differences around a window. The red and yellow areas are hotter next to the cooler blue areas below the windowsill. Large differences in temperature on surfaces can lead to condensation. Many things can change the conditions that give rise to mold. When residents change the furnishings in their homes, such as pillows, carpet, mattresses, or furniture, the mold exposure can change. Donated and even new materials can have mold, depending on where the materials have been stored. Home visitors might consider this when they see new or different furnishings in the home. In some regions of the country, people live in their homes differently according to the season. For example, in hot summer months, the air conditioning might be used a lot and windows and doors are closed. Any asthma triggers in the home can get sealed indoors. Likewise, in the cold winter months, the home can get sealed and the asthma triggers in the home are sealed in too. In fall, raking and walking around outside can bring mold inside from leaves. Pets can also change the mold levels in the home. They might bring in mold from the outside when they jump, and then they jump on furniture and beds. This increases the concentration of mold spores in the home, although it might not necessarily lead to mold growth on a surface. Frequent vacuuming with a HEPA filter might help remove mold brought into the home. Cleaning out filters and vacuum bags can lead to exposure, so appropriate precautions should be taken. Bags should be emptied in an area away from the main living space, such as in a garage. And finally, the use of humidifiers usually means the air is dry and people are trying to make it more comfortable. However, if the humidifier is located near a wall or close to the ceiling, moisture can build up on a surface and that can lead to mold growth. Humidifiers should be cleaned frequently, following manufacturer's instructions to make sure that mold is not growing inside the appliance. Now I'll turn it over to Scott Damon.
Thank you, Ginger. As you heard, I've been the health communication lead for Asthma and Community Health Branch for 20 years. And what I want to do is I have a brief presentation. I'm going to give you some basic information on preventing and remediating mold growth, like the slide says, and point you to where you can find the more detailed information that we really don't have time in this brief webinar to go over. Next slide, please. So as I said, I want to point you to the more detailed information. So on each of my slides, you'll see the fact sheet like this to the right. This is our one that is about controlling mold growth. It's written for a residential application, but works for other buildings too. Excuse me. And the URL where you can get this, hopefully you can click on that, but if not, you'll be able to cut and paste it into your browser. So as Ginger said, the key to mold control is moisture control. So if you're not making the effort to fix the leaky pipe or the hole in the roof, and all you're doing is cleaning up mold, you're going to just be cleaning up mold for a very long time. Another thing to consider is that mold occurs in sort of emergency and non-emergency scenarios. In a non-emergency scenario would be something like some of the things Ginger discussed: a leak in the plumbing, a leak in the roof, a leak in a window casing, something like that. And again, you need to fix that so the moisture is controlled. You also need to think about ventilation, particularly in a bathroom or a kitchen, the most humid parts of your house. Oftentimes those rooms will have fans, and that's what they're for, to help you control the humidity, among other things. And in terms of humidity, on the fact sheet to the far right, what looks like an old style cell phone, that's a hygrometer or moisture meter. You can pick those up at a lot of home improvement type stores. Our recommendation, as you just heard, is to keep the humidity level in your home below 50%. It's important to note that you need to take readings in multiple rooms in your home. You know, the reading you get in a living room is not going to necessarily be what the reading is in your kitchen. And you know, to keep humidity down, you can use a dehumidifier, you can use an air conditioner, or of course you can open windows if the weather conditions are favorable for that. Now, an emergency scenario where mold is growing would be something like after a hurricane, after a flood, or if your washing machine hoses decide they want to wash the entire house. So the important thing to remember there is, you know, don't wait. Anything that's been wet for 48 hours or more, or you know, a couple days or more, that you can't clean and dry, you need to remove it from the house, because mold could start growing and spreading from there. Things like carpets, fabrics, mattresses. We used to say, you know, if they're wet and you can't do anything with them, throw them out. Now we say take them out, because you might need to hold on to them long enough for the insurance adjuster to show up and you'd be convinced that you actually have lost these things. And in terms of ventilation, in a post-flood scenario, you need to be careful that your air conditioner hasn't been compromised. You should have it inspected if you suspect that before you turn it on, so you're not circulating the mold. A question we frequently get is about testing for mold, having your home tested for mold. We don't recommend routine sampling, routine testing of mold in homes because they're not really a reliable, it's not really a reliable thing to do in determining an individual health risk from the mold exposure. If somebody's sensitive to mold and if it's seen or smelled, it's a potential health risk. And again, you know, we feel like if you can see it or smell it or both, you should take the steps to remove it, and of course to address the moisture issue. Next slide, please. Okay, so you've had a flood from a burst pipe, from a hurricane, from something else. The number one thing we want you to think about is being safe when you're cleaning up. Some people should not take part in cleaning up. If you have asthma or COPD, some other respiratory condition, if you're allergic to mold, if you have an immune compromised condition, you shouldn't be part of the cleanup. Particularly if the cleanup is a scenario where a hurricane has come through, which normally means other damage to your house. There can be other hazards in the house. So that's why we say kids should not be part of a cleanup. You need to think in terms of, like I just alluded to, site safety. You know, if you go in to clean up the mold, are you going to put your foot straight through the floor because it's been broken? Is there a live wire somewhere? All those things think about before you even really think about getting in there and cleaning up mold. And then finally, think about your personal protective equipment, or PPE. That's what you see in the first fact sheet here. That would include impermeable boots, impermeable gloves, so not the surgical gloves that everyone was wearing the past couple of years, eye protection, goggles, not just your sunglasses or something like that, and a respirator, not your cloth or paper COVID mask that you've been using, but a respirator. Dr. Omari is going to talk more about respirators, so I won't say any more there. Then you need to remove what's in the way, basically, standing water, mud, anything like that, before you can get to the mold. Carpets and fabrics, like I said, you know, if they've been wet for more than 48 hours and you can't get them dry, you need to get them out. If you feel comfortable doing so, leave some windows and doors open. Well, certainly leave them open while you're cleaning, but also leave some of them open after you're done and leave the building for the day. You can use fans and dehumidifiers, but use them smartly. Don't point a fan at a moldy wall. One of the things you'll accomplish is blowing the mold off the wall and all around the room. And again, clean safely. The second item on this page, the homeowner and renter's guide, is 4 pages. And again, there's a lot more detail at these URLs than what I'm able to give you on this call. So please check there for a lot more things about safe cleaning. Next slide, please. One thing I do want to address in terms of safe cleaning is bleach. Now, we don't quote unquote recommend the use of bleach, but a lot of research, a lot of field experience tells us it's what a lot of people use. It's cheap, it's widely available. Our concern is that people use it safely. As this sheet shows you, a lot of the times you don't need to even be thinking about bleach. Soap and water can be enough. There's about 15 different scenarios noted here. I would again encourage you to go to the URL so you can read in more detail. But in terms of bleach, the number one thing to remember is don't mix it with anything except water. Don't mix it with ammonia in particular, but also don't mix it with other cleaning agents because you might not know what is in those cleaning agents. And our recommendation for mixing with water for mold removal is no more than 1 cup of standard household bleach per 1 gallon of water. So again, no more than 1 cup standard household bleach per 1 gallon of water. Now, standard household bleach is what you use in your washing machine. It's what you can get at your grocery store. If you go into a home improvement store, you can find stronger bleach. If you buy bleach that is stronger than standard household bleach, you're going to have to use less of it with your 1 gallon of water. Okay, next slide, please. And I said it was going to be brief, so this is actually my final slide. Sometimes the scenario comes up where you have to stay in the home while it is being remediated. It might be a very long-term project. You might have no place else to go. So what you need to do is think about how to stay safe in that situation. Again, some people with asthma, respiratory conditions, COPD, mold allergy, immune compromised conditions, we really recommend they are not staying in the home. If you don't have one of those conditions and you're staying there, minimize the time you spend there, unless you're one of the people doing the cleaning, obviously. But if you're staying in the part of the home that is clean, when people are cleaning the other part of the home, try to find someplace else to be during the day, visit a friend, go to a movie, anything. And then you need to seal off and separate the areas that are okay from the areas that are being remediated of mold. Basically, we're talking about plastic or tarps and so forth to prevent the spread of mold. Think about, just be smart about what you're doing. If you're cleaning, don't walk out of the area you're cleaning and walk around the clean part of the house carrying mold around on your shoes and clothes. Think about how you can leave your shoes, leave your clothes someplace where that won't be happening. Or if you have to carry your moldy clothes or your moldy carpet or something through the clean part of the house to get it out, seal it up in a plastic bag so it's not able to spread. Or if possible, put it out the window instead of carrying it out through the house. You can use the fans and air conditioning with the precautions I mentioned earlier. So that's kind of the real basics of preventing and remediating. It's not excessively complicated, but we do offer a lot more detailed information at these fact sheets. And I would also point you to our mold site, which is simply cdc.gov/mold, or you can call the CDC information line, which is 1-800-CDC-INFO, CDC-INFO, or 1-800 232-4636. That's all I've got, and I'll turn it over to Dr. Omari now.
Thank you, Scott. So following up on my colleagues' really informative presentations, today I'll talk about some work on respirator use among workers and residents engaged in mold cleanup after Hurricane Ida, sharing with you some results from data collected in Louisiana. Next slide, please. So Hurricane Ida made landfall on August 29th, 2021. Thousands of buildings were damaged, sometimes resulting in mold growth. Because the COVID-19 pandemic has increased the public's awareness of masks and respirators, the Louisiana Department of Health was concerned that masks recommended for prevention of SARS-CoV-2 transmission, yet inadequate for protection from mold exposure, might be used among workers and residents attempting to clean up mold after Hurricane Ida. So we wanted to assess knowledge, attitudes, and practices related to personal protective equipment use for mold cleanup among folks affected by Ida. We wanted to use this information to help public health practitioners develop recommendations and messaging related to respirator selection for mold cleanup in the context of the pandemic, when there are so many face coverings available for people to choose from. Next slide, please. We recruited a convenience sample of eligible respondents in Southeast Louisiana between December 4th and 14th, 2021. And you can get a sense for where we recruited respondents from this map on the right. We aim to recruit in areas affected by the path of the hurricane. We verbally interviewed respondents and entered the data into a software management system called REDCap. Next slide, please. We ended up collecting 306 surveys, including from 68 workers. We spoke with these residents and workers outside home improvement stores, at work sites, farmers markets, a FEMA disaster response center, and at a town center. Next slide, please. To give you an idea of the demographics among those we interviewed, we did speak with more men than women, especially among workers, who are represented by the pie chart on the right. Next slide, please. The majority of residents we spoke with were white, as represented by the orange section of the large pie chart on the left. And the majority of workers we spoke with were Black or African American, represented by the teal section of the large pie chart on the right. Next slide, please. So now we'll talk about some of our findings, specifically diving into knowledge and practices that respondents reported about respirators and masks. But first, I want to give you a little background on the definitions. There is a difference between respirators and masks. So respirators are made to filter air, to fit closely on the face in order to filter out particles. So when I discuss particles that are recommended for use while cleaning up mold, I'll be referring to N95 or better respirators, which are approved by the National Institute of Occupational Safety and Health, or NIOSH, here in the US. On the other hand, when I say masks, I'm referring to other face coverings, such as cloth face coverings, surgical masks, neck gaiters, dust masks, or bandanas. Next slide, please. So let's dive into folks' knowledge. We asked respondents, which masks or respirators should you use when cleaning up mold? And we showed them a visual display of all the masks and respirators you can see along the x-axis. Respondents could choose as many answers as they wanted. Most workers and residents reported that they should be using full face, half face, or disposable respirators for mold cleanup, represented by the first 5 categories in the bar chart. And this was great. That aligns with safety recommendations. However, some respondents thought they could use inadequate personal protective equipment for mold cleanup, including surgical masks, dust masks, cloth face coverings, gaiters, and bandanas. Next slide, please. So now we'll talk about respondents' practices. Which masks or respirators respondents actually used when they were cleaning up mold? Among those who had attempted to clean up mold, most said they used full face, half face, or disposable N95s. However, some workers and residents said they used surgical masks or dust masks, cloth face coverings, gaiters, or bandanas. And some 20% of resident respondents reported that they did not use any mask, respirator, or face covering at all while cleaning mold. Next slide, please. So looking at those last two slides, one after the other, brings up a contrast between knowledge and practice, between what we know and what we do. Of the 102 residents who only selected respirators for the knowledge question, what should you use to clean mold, 47% reported only using respirators when they cleaned mold. That means that about half of residents reported engaging in a practice that didn't match up with the knowledge they reported earlier in the survey. Of the 54 workers who only selected respirators for that knowledge question, 81% reported only using respirators when they cleaned mold. So that means that a pretty big majority of workers reported engaging in practices which were consistent with their reported knowledge of mold cleanup safety. Next slide, please. We were able to compare these findings to those from a similar survey collected after Hurricanes Katrina and Rita in 2005. So in these bar charts, the dark green bars represent data from the post-Katrina and Rita survey, while the light green bars represent data from the post-Ida survey. The categories displayed along the x-axis include collapsed responses to the knowledge question, what masks or respirators should you use when cleaning up mold? And those collapsed options include none, dust mask, surgical mask, or other non-respirator face covering, disposable or reusable respirator, or don't know. There's a check mark under the disposable or reusable respirator category because that's the one that aligns with recommendations. Finally, the bar chart on the left represents residents, while the bar chart on the right represents workers. We found that respondents' knowledge regarding which masks or respirators they should be using while cleaning up mold was pretty similar post-Ida compared to post-Katrina amongst both residents on the left and workers on the right. Next slide, please. However, in terms of practices, among those who reported wearing a mask or respirator during mold cleanup, workers were marginally less likely to cite respirator usage after Ida compared to after Katrina and Rita. And many factors could contribute to this, but it could be due in part to the wider availability of non-respirator face coverings in the COVID era. Next slide, please. To wrap up, we drew some conclusions from this investigation, which could be helpful for public health practitioners to think about when preparing for upcoming hurricane seasons. So many resident and worker respondents did have mold remediation knowledge and practices that aligned with recommendations. However, some endorsed using non-recommended protection for mold cleanup, like dust masks, surgical masks, and cloth face coverings. Many residents who showed knowledge of proper respiratory personal protective equipment nonetheless reported using non-recommended masks during mold cleanup. And possible barriers could include factors related to access. For example, non-recommended face coverings could be close at hand, while recommended protection could be a little more difficult to access. And another possibility is that folks may need a cue to action, something to remind them to use the knowledge that they report. Finally, workers in the post-Ida sample were marginally less likely to endorse respirator usage during mold cleanup compared to the post-Katrina sample. Next slide, please. I just wanted to take the opportunity to thank the many people at CDC and at the Louisiana Department of Health who contributed to this work. And that's it from me. Thank you.
Great, thank you. And now we're going to transition to the Q&A segment. So we've actually gathered these questions from a number of sources. They're all from the public. First question is, what kinds of symptoms can mold cause? And who would like to take that?
I can probably take that. That's a second here. Okay. Well, exposure to mold can cause various symptoms, or some people don't have any symptoms. Some people are more sensitive, and if you're more sensitive, it can, usually be a stuffy nose, eye, throat, skin irritation, and coughing or wheezing. If you have allergies to mold, you might get fever and shortness of breath. And certainly if mold is an asthma trigger for you, if you have asthma, it can give you an asthma attack. Now, people who are immune compromised or who have like a chronic lung illness, like obstructive lung disease, can develop a serious infection in their lungs.
Okay, thank you, Scott. I have stayed in a moldy home before and experienced a lot of stuffy nose and that kind of thing. Is that like a sign and I should look into my environment and maybe clean it up if I experience that?
Sure. I mean, that would, anyone should probably try to avoid staying in any length of time in a moldy home, moldy situation, because, that can happen. Stuffy nose, eye, throat, skin irritation, and even coughing or wheezing. Yeah.
Okay, great. Thank you. The next question, who is responsible for cleaning up the mold problem in my home?
I guess I can deal with that one too. If you have a mold problem in your home, you need to talk to your property owner or the landlord or your builder, depending on what your situation is. And if you don't get a response, contact the local board of health or the housing authority. The fact is that the codes, the insurance, inspection, legal issues, all that are usually under state and or local jurisdiction, not federal jurisdiction. CDC isn't an enforcement agency, and we can't provide you legal advice or legal opinion. And we rely on our partners at the local and state level to address those type of legal questions.
Yeah, well, that dovetails nicely to the next question, which is, what can I do when my landlord, owner, or building owner is not responsive to my mold problems?
Well, again, these issues generally fall under state and local jurisdiction, not federal jurisdiction. So if you're talking about applicable codes, insurance, inspection, things like that, you need to talk to your local board of health or your local housing authority. You could also, if you get a lease or building contract, you're having your home built or you had your home built, review whichever one of those is applicable. You can also contact your county or state health department about mold issues in your area to learn if they offer any sort of support or assessment. But that's not something that we are in a position to offer on the federal level.
Got it. Thank you, Scott. Okay, changing the topic a little bit. What type of doctor should I see concerning mold exposure?
Sure, I can take that one. If you're worried that you've been exposed to mold, you should talk to your family doctor or a primary care provider. They can help you figure out when you need to see a specialist. And there are different types of specialists, such as allergists and infectious disease doctors, pulmonologists for lung infections, and then occupational medicine physicians also. Your personal doctor can help guide you to the best physician to help.
Okay, thank you. What should I know if I decide to have my home tested for mold?
I'll take that one too. Just to be clear, CDC and other federal government agencies do not recommend first to do sampling of mold in homes. If you see it or smell it, address the moisture problem first. That's fixing the source is really going to help, rather than spending a lot of time and effort to collect those samples and send them off to for lab analyses. So the sampling and testing for mold is usually not reliable in determining a person's individual susceptibility or their health risk. And it can just slow down the entire process for cleaning up your home and getting to the root of the problem. We currently don't have any standards for what's dangerous and conversely what's safe. So that's another conundrum. When you have sample results in front of you, it's hard to interpret what those mean. If you see and smell mold, that's more of a trigger for what to do. And if you do decide to pay for mold testing, you should ask the company to show you how they're going to interpret the test results. And the company should tell you in advance what they will or what they will not recommend based on the test results. Thanks.
Thank you. And Amel, I have a question for you. Let's say that it's hurricane season and a hurricane comes through and my home has gotten badly flooded. And so I'm having to do all the mold cleanup. One of the important safety factors we mentioned here is protective equipment. How do I go about selecting the right mask?
Sure, thank you for that question. So we generally recommend N95 or better mask in order to, or I'm sorry, respirator to use while cleaning molds. And you can usually find these at home improvement stores in boxes. And I would recommend as well looking for the NIOSH approval stamp, which you can usually find on the front of the mask, on the front of the respirator, I'm sorry, or the box in which it's sold. And there's some great resources that you can find both on the websites that Ginger and Scott recommended to kind of guide you and remind you about which masks are recommended or which masks are not recommended, which are respirators are recommended. And CDC also provides some great resources to guide folks on putting on the mask properly, checking for gaps, and making sure it has a good fit for you. So hopefully that's helpful.
That was helpful, thank you. Hopefully I will never have to use your advice, but you never know. Another question, can you speak to the challenges of sampling and testing for airborne mold growth?
I think we already addressed that one.
Okay, sorry. We'll go to the next question. What resources exist to assist renters in reporting mold concern or advocating for proper cleanup of their units after a storm? And so it looks like we got this question more than once. And finally, what advice would you give renters who encounter mold that is not being cleaned by landlords? Is there anything in addition to what we've already mentioned for those?
The only thing I'd say is if it's a declared emergency, then FEMA or the state version of FEMA might also be able to provide some assistance to homeowners. Okay,
that makes a lot of sense. And it doesn't look like we have any more questions. Oh, wait, one question just came in from Stephen Stapleton. He asked, we have a little mold growing on the ceiling next to and on an AC vent. He heard that this can happen when the cool air from the HVAC meets the warm air in the room. Is this a factor we should be concerned about? Or if it's not easy to answer, is there a resource to investigate that? Can they just keep cleaning it? Is that enough of a solution?
It sounds like there's probably a leak around the vent. You might want to check into some weather stripping to help have a thermal barrier so you don't have such a drastic temperature change. That might help.
Okay. And that is the last of the questions. So it looks like we're done for today. I just want to say thank you to everyone for attending. It's been great. And if you have any additional questions, you may email them to ehnexus@cdc.gov and we can follow up. And as a reminder, today's presentation has been recorded. Thank you. Goodbye.